Hello, Dr. Zachary Ward back with another 10 patients in 10 minutes. In this episode, we're talking about a female in her mid-30s with migraines, head sensitivities, left ear plugged, sense of brain fog, anxiety, chest pain, a whole gamut of symptoms, and of course, a reverse curve. And this is her x-ray of her neck from her side, and I could really show you other x-rays as well, but just in the interest of time, we're just going to focus on this one. I want to point out a few things here. What we're looking at is a kind of a classic reverse curve, and we would call this a reverse S curve. I'm going to outline the shape here. It's not a serious S. Sometimes we see them that they are, like literally like this. But she has quite a bit of an S, and what you're going to notice here is the way that her first cervical vertebrae is tucked up underneath her skull, and the way that both her third and fourth and fifth cervical vertebrae go behind this line. This line is called a depth measurement. We're using the depth method for looking at the reversal of her curve, and rather than her curve, of course, going this way, it's doing that. And what you're looking at here is her after image. This is taken 11 months later, so this is quite a bit of time, and this is quite a bit of transformation over that time. Most of her symptoms are resolved or diminished within about 3 weeks time frame, including the migraines, the left ear being plugged, the head sensitivity. And those would kind of ebb and flow over the next several months as she went through these changes. We're going to drop some lines in here on this so you can kind of see what I'm talking about with the before and the after. So this is the before and the after images with the depth method lines dropped in. And what you should notice is the change in the first cervical vertebrae position outlined by this white line here and this white line here. You can see far more space on the right image than you can on the left image. You're seeing C1 move closer towards C2. And then, of course, right in through here at 3 and 4, you should see that finally these vertebra segments are actually in front of this line here as opposed to being behind it. And so the neck is actually taken out of the S curve. Now the C3 is a little bit malpositioned still yet. We'll see if her body continues to change on that. But overall, there's been a significant change in the alignment. And in fact, if you actually measure it out, there's actually been a 14 millimeter change at the fourth cervical vertebrae. So this is quite a huge shift over about 11 months, with kind of her coming out of that reverse cervical S curve. Again, if you have any questions about this case or any case in the series that you're seeing, Alignment Matters, 10 patients in 10 minutes, you can give a shout out here at laachiro.com/contact. Contact me that way. You can find me on Facebook /laachiropractic.com. If you are in the Metro Detroit area, feel free to give us a call. The office line 248-598-4002 and talk to my assistant and mention this video. Have a great day.